Hi, my name is Karen Valadares, and I will be presenting the case study Dale Morse and the New York State Measles Outbreak. So, some background information on measles. Measles is highly contagious, and the virus can spread to other people by sneezing and coughing, and the person breathing in that contaminated air. Now, according to the CDC, measles is so contagious that 90% of the people who come into contact with someone who is infected will also become infected. Measles is one of the leading causes of death among children, and in May 1982, 2 counties in New York State experienced outbreaks of measles in school children. And Dr. Dale Morse, who worked for the New York State Department of Health, investigated and analyzed these outbreaks and found that even though these people had been vaccinated, they were affected with the disease. So prior to analyzing the current situation, in this case, Dale Morse and his team continued to research and trying to understand why the vaccine was no longer effective. So the strength in this case was that there was action being taken in order to vaccinate and stop the spread of measles. The weakness is, and it still is a weakness, is that there are vaccine exemptions that hinder the goal of stopping the spread of disease and also decreasing herd immunity. Opportunity in this case, it creates a framework for other countries to tackle diseases and vaccinations. And then it goes on with the threat, and especially in this case, it talked about how there's a constant influx of people traveling to the United States and New York and importing measles and starting new outbreaks. So the mission of the New York State Department of Health is to improve, protect the health of New Yorkers, and they were a big reason why it was successful in decreasing the incidence of measles in New York. Now, prioritizing core issues. So the root cause of the outbreaks in New York City was, or in New York, was that the current vaccine wasn't working and the measles was spreading rapidly throughout the population of school-aged children. So there was outbreaks in 21 schools and 91 cases were reported. In order to decrease the susceptibility, 53,000 doses of the vaccine were given, and it cost the state almost $1 million. And that didn't include the cost of resources to treat patients who already had the disease. So analyzing alternatives. So the solution first, and that was Dr. Morse and his research found that a second dose was needed to significantly better measles immunity. The health commissioner, Dr. David Axelrod, used the information Dr. Morse found in order to convince New York legislature to implement a mandatory second dose policy as a school entrance requirement. So in the next slide, I have a more detailed version of this, but I feel like visually you can see how, especially in this case, policy was able to influence individual to vaccinate, interpersonal level, family and friends vaccinate and encourage others, then an individual is more likely to vaccinate. At the organizational level, healthcare providers can also promote vaccine uptake, and that's, telling them the benefits of vaccinations. And here in New York, the community saw that there was a problem with measles, so they wanted to eliminate it and promote vaccination. And then this is what I just went through, and talking about how each of these interplay and eventually can lead to policy change. So 2 studies I found that influence vaccine uptake at the individual level. They applied the health belief model, and doing that and putting interventions increase vaccine uptake. A study found at the institutional level, if a provider showed the benefit to the parents directly that affected the child, then it increased the parents' vaccine intention. So recommendations that came from the actual case was the 2-dose policy, and to implement that into school entrance requirements. Another recommendation that could be used would be to increase surveillance of the importation of the disease, because that is a problem, and also to respond to outbreaks quickly from importation so the disease can still be contained, because we're never going to be able to control how other countries or states use their vaccination policy. So the action plan in the case was that Dr. David Axelrod presented the findings of Dr. Dale Morse to the New York legislature in May 1989. And then 2 months later, in June 1989, the New York legislature enacted a law that required kindergarteners and first-time college students to have 2 doses of the vaccine. And then in August 1990, after they gave people time to vaccinate, they made the requirement go into full effect, and you had to be vaccinated with 2 doses in order to enter school. In conclusion, policies are crucial in promoting the health of populations. And this is what we saw in the case of the New York measles outbreak. It showed how surveillance and epidemiology data were essential in establishing the policy that New York put. I believe that more vaccines should be added to the list of mandatory vaccines, but until then, we can apply the social ecological model and have interventions at each level. All of them interplay, and later we can use the data obtained from the interventions and show how their success to policymakers and change policy and increase the vaccination list. Thank you so much for listening to this presentation, and I hope you enjoyed it.